Good afternoon and welcome to the third floor conference room of Waco City Hall. I'm Larry Holsey, Director of Public Information and Communication for the City of Waco. I want to welcome you to another one of our press conferences that our three gentlemen have agreed to continue with to provide you with good information, up-to-date information on the current situations, not only just the COVID, but some other situations that are strong on all of our hearts and lives as well. And we'll follow the same procedures that we've done before. We'll allow each one of the representatives, our Mayor Kyle Deaver, Judge Scott Felton, and Dr. Jackson Griggs, who is the CEO of the Family Health Center, to make a statement. And then we'll answer questions that I've received and come up with some of them. And then we'll open it for questions that we have three representatives from media on the phone this afternoon. To start us off, though, I want to make sure that everybody that is a Spanish speaker knows that this entire press conference will be replayed at 4:30 this afternoon with a full Spanish translation. Down in our studio downstairs, not only do we have an American Sign Language interpretation being shared because we want all persons to be involved with the information we're sharing, but we also have a Spanish interpreter recording an audio track that we'll lay over the video of this. And always so gracious to be a part of this to help our Spanish speakers be involved in this is our City Council Representative for District 2, Hector Cebito, to invite those. Hector?
Thank you, Larry, so much. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco, aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you so much.
Thank you, Councilman Cebito. We always appreciate you. All right, we're just going to start right on off. Mayor, if you'd like to do your opening comments, we'll get going because we've got a lot of questions, try to cover a lot within the hour that we have.
Sure. Thank you, Larry. And thank you all for being here again today. Several things to talk about. First, the protests and other activities that have been intended to raise the awareness of the need for reform for racial equity and justice have continued to be peaceful in our community, and I so appreciate that. It makes the message much clearer, and it keeping the peace is so important to having that message heard and keeping our community peaceful. I really appreciate that work. Yesterday, radio station 94.5 The Beat stopped the music for 4 hours from 2 to 6 p.m. For an important community conversation about race equity and police efforts. I was fortunate and honored to be joined from the 5 to 6 o'clock hour by our police chief, Ryan Holt, our deputy city manager, Bradley Ford, Sheriff Parnell McNamara, and District Attorney Barry Johnson. In that conversation, there were 4 separate hours with different guests speaking and discussing these matters throughout the day. Council member or Mayor Pro Tem Andrea Bearfield, as well as County Commissioner Patricia Chisholm Miller, were in the earlier hour to me. I'm so proud of our police department for leadership and especially the officers that serve our citizens every day. These men and women do extraordinary work in a very difficult and dangerous situation. And anytime you have something that, like what happened, the tragic death of George Floyd in Minneapolis, it makes their job so much harder. And I know that they are stressed and working hard right now, and I ask for your prayers for those people. On a much lighter note and a better note, the City of Waco will begin this afternoon issuing estate sale and garage sale permits online at waco-texas.com. Look under the latest news tab and you will see the online application so we can get those going for all those folks that have been waiting patiently to get that activity going again. I do have some slides to share with you this afternoon. Let me see if I can get those up. That does not look like the right slides. Are the case count slides up at this point?
Yes.
Okay, thank you. Sorry, I'm having a hard time seeing it on my screen. All right, this first slide shows the slide that we show every week. This is the confirmed new cases and the orange line is the cumulative line of cases. You can see that it has remained relatively flat, but there has been an uptick in the last few days, last week or so. We'll talk about that more. Our hospitalization has continued to be very low. We have generally been below 2 people in the hospital and one or fewer people in the ICU for the last more than a month. But I understand that we have some new numbers there today that are a little bit concerning. So we'll talk about that a little bit later with Dr. Griggs. This is the Texas positivity rate. Again, this is the number that the governor is looking at as he reopens the economy. And it had gotten down to around 5% and was hovering there for the last 2 or 3 weeks. Over the course of this past week, the 7-day average has gotten up between 6.5% and 7%. And so that is something we need to keep an eye on. And I'm sure the governor is keeping an eye on, because that is the number of positive tests over the total number of completed tests. So that's that tells you that even though testing is going up, the number of positive tests is going up as a percentage at a faster rate right now. The Mclennan County positivity rate continues to be very low, especially looking at it on a rolling 7-day average. It's actually come down from last week. We're below 0.5% again, and hope we can stay that way. But I want to show you a couple of slides that I have not shown until today. One is just looking at the number of active cases. That is cases that have where the patient has not recovered yet or not passed away yet. We have had 4 deaths in the county, but we've had lots of recoveries. You can see that back in late March and early April, we got up in the 40 range for active cases. About 3 or 4 weeks ago, we were down below 5, which was just remarkable, and we didn't think we could hold that. We have bumped up again to almost, I guess, to 18, and then came down and bumped up again. And these little spikes give me some concern that things may not be going, we are starting to see more prevalence of cases in Mclennan County. And so we need to continue to pay attention to that. And then finally, Dr. Harley Verner, our Mclennan County Health Authority, prepared this slide, which is kind of shows a timeline of when things have happened. Back in March 23rd, we issued our shelter-in-place order. We were and this is a running 5-day average, so it's a slightly different number of days, but it will bear out about the same. And again, these are just new cases. This is not active cases. But you can see that we bumped up a little bit more after we issued the shelter in place, and then we really started to bring the curve down. And then you can see each phase of the state's reopening. The first phase on 4/27 was followed by a little rise and then a decrease. The second phase on May 18th was followed by a rise. And then the third phase on June 3rd was followed by a rise. All of these are not surprising because you've got more people mixing together, but there are things that we need to continue to watch and just continue to bear in mind that COVID-19 has not left Mclennan County or the state of Texas or the United States or the planet Earth. We've got to continue to be vigilant as we go through this reopening so that we continue to keep people safe and be able to run an economy without taking too much risk. With that, Judge, I'll turn it over to you.
Thank you, Mayor. Well, as we expected, as the economy is more open, and plus school and the farm that it was in is over, and people are getting out and about more, that there would be some impact on these numbers. Fortunately, we still have ability in our hospitals and all to handle some increase. But it is something that we will continue to monitor and try to report to the community about what we see in trends, and also any additional information that we can learn to for people to follow that would help them stay healthy and safe and have a great summertime, and be prepared to go into the fall on whatever it's going to look like. One thing that's encouraging is we are seeing our local economy at least have some come back, and some of the things I'm just have a perception that it's going to be better because I drive around. I've already been in a couple of traffic jams. I didn't think I'd ever miss being in a traffic jam in downtown Waco or I-35, but I did kind of miss it because I knew why. And so we're seeing more activity out there. And as we increase testing, and especially testing where you scope into a nursing home or a industry to try to get your arms around or to have a tactical approach on infections, that those numbers are going to increase quite a bit. I am encouraged, as Mayor pointed out, that our positivity rate here locally, although maybe slightly understated, or maybe we are in a pretty comfortable place right now. And again, I think there's a question that comes to me later on pertaining to people that are at the age group or have a health condition that may put them at more danger than most people about that we really pay attention on how we can stay healthy if we're in that sensitive age group or have health conditions that would expose us to a lot more risk. So with that, I'll look forward to answering any questions. Thank you.
Dr. Griggs?
Yes, thanks again for the opportunity to come visit with you about kind of where we are in this pandemic. So I'll start broad context and then kind of zero in on our community. Worldwide, there's over 7 million cases now of SARS-CoV-2, of the novel coronavirus, and there have been 411,000 deaths due to COVID-19, the disease that the novel coronavirus causes. And then in terms of incidents, that's new cases broken down by continent. Europe has reported fewer than 15% of the new COVID-19 cases in the past week. North America and Asia have each reported about 25% of new global cases. The subcontinent of India has been showing accelerating cases, and that's a real area right now of concern because of the aggressive increase in the case rate. South America's proportion of the COVID-19 cases continues to grow as well, and right now is around 30% of the global total of new cases. The United States is just shy of 2 million cases. We will probably cross that 2 million case mark in the next 48 hours or so. We've had 112,000 deaths to date in the United States. And as states continue to relax their policies pertaining to social distancing in order to boost our flagging economy in the sort of the aftermath of the Memorial Day celebrations from the weekend, and of course then the large-scale protests against racial injustice, there is a concern about growth in transmission rates nationwide. So remember that there is a delay. We don't see increase in case counts immediately after an event or a weekend, but we'll be seeing the impact of those phenomena in the next week or two. Texas is one of the states that are most concerning right now in the country due to a growing number of new cases. In late May, we were describing around 1,000 cases a day, and now we're getting closer to about 2,000 new cases across the state. There have been a total of 77,000 cases reported in Texas, and not surprisingly, it's the urban centers, Houston, Dallas, Fort Worth, Austin, El Paso, San Antonio, that are seeing the highest numbers right now. thankfully, at this point, there's not any imminent risk of hospital bed or ventilator scarcity in Texas. There have been a total of 1,853 deaths in our state. So we've not seen that death curve yet follow the case curve, but we likely will. I've reported on the effective reproduction rate, that's the RT, from time to time. And a couple of weeks ago, I mentioned that it was above 1, it dipped down, and it's above 1 again, and will probably stay above 1. That's also concerning because it's a reflection of the infectivity or the spread of the virus. Mclennan County updates as of this afternoon. So this is new information. A total of 141 confirmed cases, 19 of which are currently active. We have on Monday we had 3 new cases, Tuesday 6 new cases, and today we've had 3 new cases. They are hospitalized patients with COVID-19. 2 of those 3 are in critical condition. The health district is currently monitoring 142 individuals, and we have not changed our death total number of those who have died from COVID-19. It's still at 4. And total tests completed, this is as of June 9th, 10,511 tests on Mclennan County residents, 12,802 tests performed by all healthcare entities in our county.
Okay, thank you, gentlemen. Mayor, before I get started with the questions, I'd like to add something I neglected to tell you regarding your announcement regarding the garage sale and estate sales. The city is waiving any fees that we would normally charge for that. So it's a great time to go ahead and take advantage of what you've been deprived of and get online and get that permit. You still have to get the permit by going to the waco-texas.com homepage and to take it from there. But there's no fees being waived for the time being. So great opportunity. All right, let's move on with the questions. Question number 1 I have, when were the test results that are coming back positive now taken? And how significant is the delay between the initial test and the result?
Dr. Griggs, can you take that, please?
Yeah, absolutely. When across the state, the commercial labs were first bearing the burden of the specimens that were collected in all of the nursing homes and all of the nursing home staff, there created a backlog. And so the way that impacted us locally, our commercial lab, we were seeing 48 to 96 hour delays before we were seeing results. And so we were beginning to use a kind of limited supply of our Abbott ID Now. That's the device that will allow you to get instantaneous results. We have very few of those cartridges relative to the kits that we use for the usual commercial labs, and we were using those on those cases that were where there was a high probability of COVID-19. But now the commercial labs are starting to catch back up this week, and so we're seeing closer to the 24 to 48 hour turnaround now this week. So we're beginning to reserve those cartridges that are for the Abbott ID Now instrument, those that we get instant results back, and are beginning to use the commercial lab more regularly. I can't. So that's the Family Health Center. I can't speak for the other systems and the delays that they are seeing or the recovery from those delays. Obviously, long wait times for results are important because people want and need to know, and we need to know for their own decisions about whether or not to go out. And then the health district needs to know those results so that they can perform contact tracing when we do have a confirmed positive cases. So prompt results are very valuable. It's also, I think, really important that if you do have symptoms, you stay in self-isolation until you get a message from your primary care clinician regarding the all clear, or if you're confirmed positive, wait until the all clear from the health district, which is usually after a period of self-isolation.
Dr. Griggs, just to follow up on that, I looked on our COVID Waco site this morning, and they are now showing on that site, when you download the data about testing, daily testing, the number of tests that are pending. And we've really ramped up our testing over the last week or so because of testing all the nursing homes. We have about 500 cases, a little bit over 500 cases pending, but all but 5 of those are from the last 5 days. So they're getting results back much quicker than they were this time a couple of weeks ago.
Okay, next question. As people begin to congregate for various reasons again, what kinds of gatherings put people the most at risk?
Dr. Griggs, if you could take that one, please.
Yeah, it's events where people are clustered tight together, particularly events where people aren't wearing masks. Certainly events where people are indoors, speaking loudly, singing, shouting. Those are those events that are most risky. So church events where there aren't appropriate protocols in place to protect congregations, any kind of indoor party or gathering. Athletic events can be risky when people are sitting close together on the bleachers and cheering for their children who are playing baseball. So it requires a sort of attention to all of these factors. Obviously, if you know you're going to be in a crowd, please wear a mask and try to stay outdoors and don't cluster if you can at all avoid it.
Okay, how many people with the health district are assisting with contact tracing, and at what point might we need more?
Larry, we currently have 70 trained health district staff that are trained on and capable to conduct contact tracing. We try to keep a 1-to-10 ratio of employee to cases tracked. So that gives us the ability to track 700 people without having to bring on additional staff. Now, obviously, those 70 health district workers, most of them are currently performing other duties at the health district. So it would be a little bit complicated to bring all of them into this, but that would be a priority, and it would probably be a short-term, short-lived situation. So we have very adequate capacity right now to contact trace. If these cases start to ramp up and the number of close contacts ramp up, we still have the ability to train more folks as that becomes necessary, if it becomes necessary.
Okay. How many of the people who are currently sick know how they got COVID-19, or at least had an idea of where they might have contracted it?
Dr. Griggs, can you try to answer that?
Yeah, this is conjecture, but my suspicion is that a majority of individuals at this point know, and that's because we have such a low incidence and because the health district has done such a marvelous job of contact tracing and monitoring. In situations like New York, where you have a high population density and a very high case count, there's more spread among people who don't have symptoms, and so I think that it's a majority of individuals that don't know where they have contracted the disease. But incidentally, the health district, while they don't routinely disclose any information to other individuals about those positive cases, they do encourage individuals who have been confirmed positive to notify their close contacts. So they try to get an individual who, if somebody's positive, they try to get that individual to let all of their close contacts know, and then of course the health district does follow up with all close contacts and implements contact tracing.
Okay, in Mclennan County, most people who've gotten sick are 20 years of age or older. What are the ages of those patients who are 19 and younger?
Dr. Griggs, do you have that information?
Well, I know that it's 5% of those who of our total, and that's from our COVIDwaco.com website. So an unabashed plug for that website if you're not already checking it. It's got lots of good information. So 5% of 141 cases, that's 7 cases total that are less than 19 years old. Of course, giving more detail than that runs the risk of breaking the anonymity that we try to protect, trying to keep people's privacy protected. So in this case, I don't have any additional information about those 7 cases that are less than 19 years old.
Okay. In recent days, the Public Health District has shown an uptick in confirmed cases in Mclennan County, 3 on Monday, 6 on Tuesday, and now you just announced 3 today. Does this indicate that we're relaxing our efforts too much?
Well, let me take a stab at this and then see if Dr. Griggs wants to add to it. It seems to me that it might, and we need to continue to watch this carefully. As I mentioned, our 7-day rolling average on the positivity rate is still really low, but I am concerned that the denominator of cases completed is much larger right now because of the testing that we've been doing of the nursing homes. And most of those tests have come back negative. The vast majority of those tests have come back negative. And so we've had some other cases in the county that have tested positive recently in larger numbers than we're used to. And so that positivity rate, if we weren't doing the nursing home testing, I think might be on the rise right now. But again, we're still so low in the total test count that I think we're okay, but it definitely bears watching in my mind. Dr. Griggs, do you have any thoughts about that?
Yeah, absolutely. The low incidence continues to be really good news for us, but it is a little bit of a double-edged sword in that there isn't a lot of people. There aren't a lot of people in our community who are immune to this virus. So we're a very susceptible community. We've been able to keep the death toll low because the incidence is low because of all the health behaviors that have been put into place by individuals. But it also means that there's a lot of people out there that are still very susceptible to this virus. And so we really must not become complacent, particularly when we see an uptick like this. We expected some increase in case rates because of the changes in policy. And so now, if ever there was a time to really redouble your efforts, it's now.
Okay. In Sunday's Tribune Herald, there was an article saying that childhood vaccinations have nosedived since COVID-19 nationwide, as well as here in Mclennan County, with fewer kids being immunized to diseases that already have a vaccine. What are your thoughts about that?
So, Dr. Griggs, I'm going to ask you to take this one also.
Absolutely. So 3 weeks ago, the CDC put out in their weekly report an article describing the sort of the dramatic drop in routine pediatric vaccinations in the United States starting around mid-March. And this is certainly consistent with what we were seeing at the Family Health Center. Initially, this is exactly what the health community expected to see. We were holding off on all of our non-essential visits to avoid a surge and to allow us all to develop protocols in our clinics to protect patients that visit the center. And now that those protocols are in place, we certainly, from a public health standpoint, we need to get children back in to get their routine vaccinations so that we don't see outbreaks of other infectious diseases, some of which are, particularly in children, much more dangerous than COVID-19.
Okay. Why do some people recover so quickly from COVID-19 and others have to be hospitalized?
Dr. Griggs, I think it's going to be the Dr. Griggs show for a while.
It looks like it could be.
That's good.
Sorry, but yeah, okay.
Good thing.
There probably are 3 different factors: genetics, the root of infection, and then a person's immune status. So there are everybody's cells, we have surface proteins that have different functions. These also become the sort of the gates for the virus to enter the cell and hijack the cell's genetic machinery to replicate the virus's genetic information before the cell ruptures and spreads the virus to other cells. So if you have surface proteins that are kind of inhospitable just by a genetic good fortune, you have surface proteins that are less hospitable to those viruses. The viruses have more difficulty accessing the internal milieu, the internal environment of the cells, and so you might be more resistant or less likely to have replication of that virus in the body, giving your own immune system a better opportunity to fight off the existing viruses. So that's the genetics. Infection route, how the virus gets into the body, whether it's via the nose or mouth, or if you inhale the virus, it gets down deep into the lungs, particularly when there's a lot of virus. You're standing close to someone who sneezes and you inhale a big bunch of that virus and it gets down into the pockets of your lungs, more likely to potentially more likely to experience complications than perhaps if you touch a doorknob and then scratch your eye and you get the virus that way. This is some of this is theory oriented and not we don't have concrete evidence on some of these things, but this is based on what we know of other similar viruses. And then someone's immune status. If a person's history of prior infections, if someone has been infected with a germ that has similar proteins to the coronavirus, then their immune system may be partially immune to this virus. They may be able to fight off this virus better. And in cases where someone is an aging adult, or if they have other chronic conditions and their immune system just isn't as able to mount a good response, then there's a lot more opportunity for that virus to replicate and take over the body before the immune system has a chance to fight it off. And so I think that's why we see so many aging adults and people with chronic conditions who have major complications and who die from this virus.
Okay, cases are rising in Houston. Should we be concerned with this trend now that Waco has reopened many of our tourist attractions?
Dr. Griggs, I need you to answer that one too, if you can.
Yeah, I think concern is appropriate. I don't think alarm is necessary, but I do think that that wisdom would suggest we are all vigilant on an ongoing basis. And since Memorial Day, Texas has seen a 36% increase in hospitalizations due to COVID-19. So it's not just Houston; it's the whole state. Houston specifically has seen the highest hospitalization due to COVID-19 in the past week among cities in Texas, and their health officials are attributing it to the fact that residents have, and I quote, let down their guard and come in closer contact with others. So I think we need to keep closely monitoring our trends, and I'm really, again, to reiterate what others have said, I'm just so grateful to those involved in Waco tourism that they're taking this issue so seriously. They really are, in some ways, guardians for all of us. When they do a good job, they're protecting our whole community. So I'm really grateful to those who are in kind of in their own domain. They're on the front lines for all of us.
Okay. With people beginning to attend church services again in person, what policies should churches adopt to ensure safe experiences? And one other specific point on this one was, what about church choirs?
Well, you know, a lot of churches are continuing to stay closed a while longer, and I think that's wise if they can do that. But I'd like to ask Dr. Griggs to address what precautions should be taken if you are having church in person.
Yeah, and I'll get to a few specific guidelines, but as you've heard me say, this is something that I feel myself kind of pulled in two directions. My own church community is a source of great personal strength, and at the same time, you know, we have to be very, very careful about not being an arena where we share the virus internally and then go out and share it with the rest of the community and do damage. So I think that it's a really good question. In Arkansas, 92 people attended a church where 2 people later discovered that they had the coronavirus. So a couple days later, 2 of those 92 people were positive, and there were then 35 church-related cases that were tracked to those contacts, and 3 people died. There's a well-documented case that was explored in South Korea where a woman with coronavirus apparently spread the virus to 43 others at a church service. And in Washington, a choir practice led to the spread of 45 people and 2 deaths. So this is a really relevant question. And from a scientific standpoint, it makes a lot of sense, having a lot of people from different households enclosed in a space and singing. 2,600 droplets per second come out when you're talking, more when you're speaking loudly. If you sneeze, 40,000 droplets emerge. I mean, so it's an important environment where spread can really take place. Virtual services are by far the safest approach, and should probably be seriously considered by the health vulnerable category. So if you are an aging adult, or if you have chronic conditions, it might be best to attend virtually and not show up in person. But as priests and pastors and rabbis and other church leaders begin to think through and guide congregations, here are some suggestions. So first, as faith traditions allow, hold services outdoors. If this isn't an option due to the heat, then meeting in a large, well-ventilated area. So think fans and open windows, try to circulate that outdoor air. If possible, attending in smaller groups of individuals who are more spread apart. There's no reason that members of a single household shouldn't sit together, but individual households should probably be spread out by at least 6 to 10 feet or more. And it may mean that congregations need to hold multiple services during a given day so that all of the members have a chance to worship. Number 3 is providing physical guides, so tape on the floors, walkways, signs on the wall to ensure that congregants remain at least 6 feet apart in lines and at other times. Putting caution tape or some other markers across pew spaces or chairs so that congregants can see how to space out safely. You can tell a group of people, but it's much more helpful if you're demonstrating how to sit or the appropriate way to sit. Communicating with parents. This is item 4. Communicating with parents so they can help prevent children from clustering with children from other households. 5 is really encouraging full participation in face coverings. Even providing face coverings for people when they come in. That's probably the best option for those who forget to bring their own face covering, to provide some way in which they can cover their face if they arrive without a face covering. 6 is a hard one. I love to sing in congregation, but limit singing as much as your tradition allows, particularly if you're indoors. Consider using a soloist if your congregation typically uses a choir in order to protect the choir, or use a small choir of individuals who are separated by 12 feet or more from each other. Since they're singing and projecting, it's probably prudent that they spread out a little bit more than the usual 6-foot rule. And then 7, finally, clean and disinfect frequently, particularly those high touch surfaces or any shared objects. So if your congregation usually passes a plate, remember that plate can be the way in which people pass the virus from individual to individual. So it might be a time in which to kind of change some of your usual processes and protocols. If there's anything that that multiple households might touch, it needs to be washed or cleaned between use.
Okay. Are there any restrictions for home-based businesses? What about swim lessons or piano lessons in a person's home?
Larry, there aren't any additional restrictions for home-based businesses other than what's already been issued by the Department of State Health Services and the CDC for different kinds of businesses. People who are running their businesses from home should go to the Texas Department of State Health Services website and look at the guidance that has been given for a business that is similar to theirs. In the case of piano lessons and swim lessons, I think it's primarily going to be maintaining the physical distance of at least 6 feet apart. Obviously, that's a challenge on piano lessons, and it may be that piano lessons shouldn't be conducted right now. But you've got to be smart about that. You could perhaps have a piano lesson and have a partition, plexiglass partition between you and the student, or something like that, to create that barrier to keep those droplets from spreading from one to the other, either from the student to the teacher or vice versa. But beyond that, they just need to look at those protocols. That's the way I see it here in Waco. Do you have any different thought about that for the county?
No, I think it depends on what kind of lessons they are and how close the teacher needs to be to the student. And, if there's actual where you have to put your hands in the same place, that would make a difference. Like I said, there's just a tremendous amount of guidelines out there that one could look at and get good idea on how to approach it.
Now that travel restrictions are loosening, how is the Waco Convention Center beginning operation, and will they be hosting any conventions soon? Even getting specific, are there any previous cancellations that have maybe changed their minds, or things like that going to change in the future?
It's going to be slow, Larry. The Waco Convention Center is preparing to open on July 1st at 50% capacity. As of now, we have one contracted convention group that is coming and 4 social events that are scheduled in the month of July. None of the previously canceled events have returned to their original dates at this point.
Okay. Kind of on that same subject, when do we expect the local hotels to start filling up again?
Well, Judge Felton, I know you're watching this because of partly because of the venue project at the Heart of Texas Fairgrounds. Can you speak to that?
Well, of course, they've been very low, in some cases non-existent. For some hotels have chose to close until they could get a higher occupancy in there. But just like the convention center, as these activities start booking, I think it'll be a slow growth all the way up till this fall. And depending on what's going on with the COVID-19 situation, it would determine what athletics and other entities that host or sponsor big events such as football, sporting, arts, and those kind of things happen here will make a difference too. And of course, Magnolia. But hopefully it'll ramp up. But we're not looking for a real fast increase in that.
I have 2 more, and then we'll probably move to the online questions here with the reporters. This is kind of follow up on the same thing. When will the LaSalle and Silo trolleys start running again? Everybody's excited about getting everything going again.
Yeah, we're not going to restart the Silo trolley at this level of social distancing guidelines. It's not big enough to make sense for capacity for that shuttle. But the LaSalle shuttle is currently operating with social distancing guidelines or physical distancing guidelines. The LaSalle shuttle uses the same route as the Silo District trolley and then goes out to LaSalle. So people are able to use that at this time.
Judge, I'm going to let you get a little more information because the question was kind of posed. What about the status of the Heart of Texas Fair Complex project? How are we doing on that?
Well, the project to build a new center out there is going along real well. Of course, the COVID-19 really hadn't affected it, and it's how it's progressing. It's been more affected by the rain than it has anything else, but it's going well. Now, the revenue to service those bonds that are paying for that is affected by the COVID-19 and what we just mentioned, that the hotel occupancy is down, therefore the revenue's down, and therefore the tax revenue's down to us. So other than that, out at the Heart of Texas Fair, it's been fairly pretty much shut down as well in activities, but is starting to add more things. They've provided a plan to the city and the county to have a what's called a fair food event that was held, and it was very safe. They knew they did a great job of putting that on. The city code enforcement folks were out there and were, from what I understand, impressed on how they put it on. They've had some small horse shows and things where there was really not a lot of attendance there. It's more of a competition points and those things for those animals. And then, of course, there'll be other things that they're planning going forward. So those plans will be reviewed and we'll look at that. But that's kind of what's going on in that area.
Okay. Mayor, we've got 3 representatives from 3 different media outlets across the city, and if you'd like, I've given you those names earlier. If you'll go ahead and monitor that for us, and we'll hear from what their questions are.
Sure, I'll be glad to do that. Drake Lawson from KWTX, are you on?
Yes, sir, I am, Mayor. Can you guys hear me okay?
We can.
Okay, perfect. So my first question, and maybe Dr. Griggs, maybe you want to jump in, Mayor Deaver or Judge Felton. Currently, Mclennan County is testing more than 10,000 people, according to the website. Bell County has tested close to 20,000. While Bell has more than double the cases of Mclennan County, is testing a reason for the higher numbers in Bell County, or is there possibly another factor as why Mclennan County's numbers are not nearly as high as Bell County?
Well, I'll take a quick shot at that, but then let Dr. Griggs and or Judge Felton join in. I mean, I think every community is different. There are different factors that come into play, and I think I would be more concerned that they had more cases simply because they had more testing if our hospitalization rate was higher than it is. But I think the low hospitalization rate to me helps confirm that yes, they've had more tests, and I think maybe Dr. Griggs knows a little bit about why they've had more tests. But I think you've just got to look at that positivity rate to see. And I don't know whether they are publishing the daily tests that they are given because I asked about that. We asked about that last week and weren't able to find that information. But Dr. Griggs, do you have any additional thoughts about that?
No, I would agree that ultimately hospitalization and even more absolute is the mortality rate. When you're looking at communities and you're concerned about access or testing rates, or the final story is the mortality rate. So I think comparing that would be helpful. I don't know offhand what the Bell County mortality rate's been, what the death count has been from COVID-19. I do think that the positivity rate, which is something that Mayor Deaver has been very helpful to report on regularly now for maybe 3 weeks or so, also informs the whether or not it's simply a matter of more tests, because the numerator of that is positive cases, the denominator of that's total cases. So comparing the positivity rate of Bell County to the positivity rate of Mclennan County would help, I think, understand whether this is a matter of just more tests or actually that we just really do have a lower incidence. And I think that that's what you'll find is that with our positivity rate being so very, very low, I don't think we're missing a lot of cases.
Rhiannon Sayert with the Waco Trib, are you on the line?
Yes. I had a question about the Juneteenth parade that's been permitted to go on. What kind of extra protective measures does the city want large events like that to take? Is the city requiring extra steps? I know they are taking some.
Well, I mean, we would just want them to follow the guidelines that the governor has set out for outdoor events, and that is, again, the 6 foot minimum physical spacing. It would be helpful if they would wear face coverings. It would be helpful if they stayed in groups inside the parade of less than 10 people, and then created space between that group and the next group. It's just all the same things that we've been talking about all the time, and that are really going to be necessary as we do things like the Juneteenth parade. I think that is an important tradition, and it has elements of First Amendment rights to it, and so I think it is proper for us to allow the community to have that celebration. Slightly different from the 4th of July fireworks event that we canceled, where we would be in charge of running that event, and the numbers of people are so much higher that we didn't feel that there was a safe way to do that in the space that we have where people normally congregate to watch the fireworks. Jasmine Caldwell at KCEN, are you on?
Yes, I'm on. Can you hear me?
Yes, we can.
Okay. Now that there are some antibody tests being used in Texas, is that something that we may see in Mclennan County?
Dr. Griggs, can you speak again to I don't know whether anything has changed recently on antibody testing.
Yeah, we're all waiting on bated breath for antibody tests to improve and for evidence that demonstrates that having antibodies against some protein of the novel coronavirus does demonstrate immunity. So we've really got two things that we're waiting on before these tests are trustworthy for broad use. One is, again, the evidence that if you have antibodies, it does indicate that you're immune. And two is better tests. Right now, and I've shared this, so forgive the redundancy, but right now, the low incidence coupled with the fact that there is a high false positive rate on the antibody tests makes it very risky for most people who get the test to trust a positive result, which, again, someone might assume communicates immunity. So let me see if I can say it again in a way that maybe simplifies it some. If someone who has maybe mild, moderate symptoms of COVID-19 goes and doesn't get the nasal swab test, the PCR test, but instead gets the finger prick test, the lateral flow test, the antibody test, and gets a positive result, it may be that positive result misguides the individual to think that, I have had the virus and now I'm immune and now I don't have to take precautions because I've got antibodies. Again, that would be the wrong way and a foolish way to interpret that test, and would put individuals at risk. So there are you can get the antibody, the lateral flow antibody test, the finger prick antibody test in our community. You really need a physician's guidance on what that antibody test means, because an incorrect interpretation of a positive antibody test could be dangerous.
Yeah, I think you said one other time that bad information is worse than no information, and that's certainly an example of that. Could be.
That's right.
We'll take one more question from each of you if you have one. Drake Lawson at KWTX.
Yes, we have one more question. Just regarding recent case updates and numbers, we've seen a large number of positive cases from younger populations. Is there a reason for this? Is it possibly just because of Memorial Day gatherings? Or I know there's been a lot of recent protests and younger people have been gathering in those. Is there a reason why the younger populations are coming back positive?
Dr. Griggs, do you have any idea about that?
Well, so I'm going to reveal how how much of how antiquated my social media practices are. But my daughter is the one who comes to me with images from Facebook or Instagram or Snapchat, and she's the one who says, "Hey, Dad, people my age aren't social physical distancing." She'll say she'll show me images from time to time, and I just see a lot of people who are really clustered together, and it just makes me nervous. So maybe some of that is that while we're working hard on communicating to aging populations and those with chronic illness, beware, this virus poses a serious health risk to you. We may not be doing as good of a job communicating with those who are teenagers and young adults. You can be the vector, you can be the carrier of this virus. It's you transmitting the virus to two people who in turn transmit it to two more, et cetera, that leads to that virus sneaking its way into the nursing home or getting into this arena or that arena where there are people who are at risk. So I think just a really diligent communication with younger populations, particularly to physically distance, could be a key.
I don't think we've seen anything so far to indicate that any of the protesters are among those that have tested positive, but I suppose it's possible that could happen without us knowing it. But also remember that there is an incubation period, and it takes a little while for some of those events to then produce positive cases with symptoms where they come in and get tested and get results back. Rhiannon Sagert at the Waco Trib.
I don't have a second question. Thank you.
Okay. Thank you, Rhiannon. And then Jasmine Caldwell at KCEN.
Just kind of to piggyback off of the protesters. Now, I know there was talk, so there are some protesters who are meeting in clusters, but then again, it's outside. So is that a concern?
Dr. Griggs?
Yeah, to the notion of concern, yes, I think we all need to have concern until the pandemic is over. I think that's what's going to keep us safe and keep the virus from spreading to those who are vulnerable. If you cannot stay physically distanced 6 feet or more, then it really accentuates the need to wear a face covering. And so, in a rally or in a protest where some of the crowd dynamics can be a little harder to predict, when are you going to be shoulder to shoulder to someone, and when can you really maintain space? I would just encourage really keeping a face covering, nose and mouth, not just mouth, but nose and mouth, through the at least around your neck, so that at any given point where the crowd dynamics shift and you're feeling kind of tightly clustered, you can quickly slip that on and protect your immediate community. Again, well, I'll let the mayor. I'll let the mayor remind us. I almost stole his thunder. I'll let him remind us at the end about why we wear masks.
Sure.
Mayor, thank you for hosting the media in questions and things. Let's wrap up now with our closing comments from all three of you. We'll start with Dr. Griggs, followed by Judge Felton, and then Mayor Deaver.
I'm going to again reiterate a sentiment that I've shared before, and that is my love for the freedoms in our country. It is such a unique thing to be in a country that has such tremendous individual freedoms, and at this moment in time, we have the freedom to choose whether to protect vulnerable members of our community or not. The restrictions from the government are relative to other countries small and are getting fewer and fewer. which really leaves the impact of this disease and ultimately the death toll among our parents and grandparents and those who are friends who are chronically ill. It leaves the impact of the virus and the death toll in our hands. And in this moment of freedom, our actions, which are obviously a reflection of our values, will show who we are as a people, without coercion, without force or law from the government. We get to make the choice. We get to make the choice as to how this virus looks in the United States, and that's a heavy burden of responsibility. But we're all we all really get that freedom and that opportunity to make that decision as individuals, as free agents. But it really matters. Our health behaviors really matter, and they really matter to those who are most vulnerable. So thank you.
Judge Felton?
That's a great point, Dr. Griggs. It's everybody's individual decision on how they want to approach this. I think with we see it in the people that they're excited that they're out from underneath, and at least in their mind, that from a lot of the restrictions that we had earlier, and therefore there's going to be a lot more activity that will be involved in. And I think I don't think there's any question we're going to see increase in numbers and those things. Hopefully we can protect the people that are most vulnerable. And, we're so lucky here in Mclennan County to have this is a medical community in a lot of ways. And we have a lot of great physicians here. We have great educators. And I think that gives us a little advantage when things do go bad. But there's so many things that the mayor and myself do not control in regards to the rules. The governor is taking that over. In a lot of respects, that's good for us. But I think it's just understanding where we are with this thing. We gotta hope for the best, but be prepared for if things look worse, and take care of each other and continue to educate each other on how to live successfully and fruitfully through these times. Thank you.
Mayor?
Thank you, Larry. Again, thanks to Judge Felton and Dr. Griggs for your time and the great information that you provide on these press conferences. And Larry, thank you from your staff, and Julie, thanks to Esmeralda and you and the City Secretary's staff for helping to bring this information to the public. I want to remind everybody about Census 2020. We talk about this almost every week. It is so important that you complete your census. Just go to census.gov and click on the button to complete your census. It will take you less than 10 minutes, and it will mean $15,000 to our community for each person who completes the census. Those that don't will cost us $15,000 over that 10-year period. And honestly, I think it's probably going to be a lot more than that. But it's a really big deal, and this pandemic has disrupted it. So we've got to ask your help and talk to your neighbors about doing that as well. I want to say again how proud I am of our community here in Waco. The way that we have responded to this pandemic has been remarkable. Our people, our businesses, our churches, the entire community has done a very good job of responding and kept our rates here in Mclennan County remarkably low. That has been through a lot of self-sacrifice, sacrifice for businesses, sacrifices for people, and we don't want to squander that. There's a strong desire for this pandemic to be over. I think everybody has cabin fever. Everybody is ready to get out and see their friends and do things like it's over, and it's not. Unfortunately, we don't get to declare the pandemic over. We have to follow the science. It's really frustrating because there are so many unanswered questions, but there are a few things that we know work, and the physical distancing, face coverings, and hand washing and sanitizing are the things that we know work. And so for us to continue to have a successful economic rebound without causing unbearable health aspects. We must continue to do those things, and it's not political. It shouldn't be politicized. It has been. We've got to look past that and look to how we make our community stronger. I will do what Jackson said I was going to do. Wear your face coverings. My face covering protects you, and your face covering protects me, and is a sign of mutual respect and desire for each other to live long, healthy lives. So please continue to take care of each other and take care of yourselves. Thank you. Have a good day.
I thank all three of you all continually for being so honest and straightforward and open for the public, and I think that's just incredible. And a lot of successes come from that. And thank Dr. Griggs, Judge Felton, and our mayor. And I want to remind people that you can get a garage sale permit and an estate sale right now, and they're free for that matter. So, but you do have to go online to get that. And so I do want to thank Julie from the City Secretary's office, Kyle from our television department up here, and Troy downstairs, Kelly Crane from the Health District for being here and helping put this on too. We hope everybody has a good time. Stay safe and have a good afternoon.